Hello again. This is lecture 5 of the skeletal system. Again, going with the Holes Essentials of Human Anatomy and Physiology textbook. And we're on the pelvic girdle and bones of the lower limb. So just like with the pectoral girdle, the pelvic girdle are the bones that attach the lower limb, aka the leg, to the axial skeleton or the trunk. So the pelvic girdle consists of 2 hip bones. Sometimes they're called the coxal bones or innominate bones, but all you need to call them is hip bones. You have a left one and a right one. So they do form joints, aka they articulate with one another anteriorly, so in the front. They're joined by the pubic symphysis, and then also they articulate in the back, posterior, with the sacrum. And it's this articulation with the sacrum that allows you to walk. So the pelvis, so the entire pelvis, is not the same thing as the bone, the hip bones, okay? The pelvis is the pelvic girdle, so the 2 hip bones, the coccyx, and the sacrum. So it includes bones of the pelvic girdle and part of the vertebral column. So you can't use those terms interchangeably. But the point or the function of the pelvic girdle is to support your body, basically. So everything above your legs has to rest on your hip bones. So that means that those hip bones have to be very strong. And they also have to provide a lot of attachment points for the muscles of your lower limbs and also your abdominal muscles. The pelvic girdle also provides protection, not as good a protection as, say, your skull and cranium provides your brain, but pretty good protection for the organs that sit within it. So these include your urinary bladder, part of your large intestine, the reproductive organs as well. And here is a picture and a radiograph of the pelvic girdle. So you can see here, this is the pelvic girdle. So this is the right one. I know it looks like it's on the left side, but it's on the right side of this person, and here's the left one. Okay, and you can see you have a bowl here. You have this large opening in the middle. This would be where a baby would come through if this were a female. You have the obturator foramen here, and then you have this pubic arch here. In the middle, this is a piece of cartilage called the pubic symphysis. This actually gets wider in the late stages of pregnancy. Pregnancy hormones stimulate this to grow wider, and a woman's hips will spread wider this way in order to provide room for a baby to be born through. This area you could sort of call the birth canal. Okay, and then you can see them all here on the radiograph. So each hip bone is actually made of 3 bones that have been fused, kind of like the bones of the skull have been fused. They are called the ilium, the ischium, and the pubis bone. Okay, these 3 bones are fused in the region that's called the acetabulum, which is a cup-like depression that is where the femur forms a joint or an articulation. Here it is on the picture, the acetabulum. Here it is. You can see where the head of the femur fits here. This is the socket. The head of the femur is the ball that makes up this ball and socket joint. Okay, so the ilium is this part that's superior, it's most superior. And then you have the pubis here, and then the ischium here, and they all come together and fuse right in the middle. Okay. The ilium, it's the largest, most superior part of the hip bone, and then it has an iliac crest. It makes a joint with your sacrum, so this joint is named logically, it's called sacroiliac. And then it also has, on the anterior portion, a superior iliac spine, similar a little bit to how the scapula had a spine on it as well. The ischium, it sits in the back, so it's posterior, and it's L-shaped, and it supports your weight while you're sitting. And then there are located on it an ischial tuberosity and an ischial spine as well. And the last bone, the pubis, is in the front, so it's the anterior portion of each hip bone. And the two pubic bones, they join together at the pubic symphysis, which again is a cartilage in the middle. And then it includes a pubic arch, the obturator foramen, and pelvic brim. So if you look here, here's the obturator foramen. Okay. Foramen, if you remember, means hole, basically. The arch you can't see here, but I showed you on a previous slide, and you can look at, if you're trained, you can look at the arch and tell, is this a male or female skeleton? Up here, the iliac crest, this is the part that makes the curve in a person's hip. It's much more pronounced in females. Part of puberty in a female, anatomically female, is that your hips flare out and they get wider, and that's what gives the woman that quote-unquote hourglass shape, is this iliac crest. And they have to widen in order to provide space for a growing fetus, have room to develop there. And then you can see the spines here. So moving on, here's the difference between the male and the female. Pelvis is just plural, pelvis is singular. So the one on top is female. I know it doesn't say that on here, okay, but if you look at the pubic arch right here, okay, it has a wider angle than the male pelvis right here. This one's much more narrow. This one's acute, and this one's more like a right angle or maybe even an obtuse angle, okay? And then you can also look at the pelvic brim. So right here, you can see this one is much wider than down here, this one. And again, it's for childbearing. You can see the iliac crest here, it's flared out. So the fetus would sit here, and then it turns in the very last stages of gestation, head down, and the back should be facing this way towards mom's front. If the baby's back is facing the other way, it's a very difficult birth. It's called a Frank breech, but the mother's spinal column here and the baby's spine grind on one another during the birth. It's a very, from what I understand, hasn't happened to me, but it's a very painful delivery, very, very difficult. But you could see here, okay, very narrow. There's no flaring there. So this would be a male pelvis. Okay, and you can just screenshot that. All right, so the lower limb, bones of the lower limb, we're going to start with the most superior part, or the proximal part. So we're going to start with your thigh, your lower leg, and your foot. So the technical term for the whole leg is lower limb, even though we tend to say leg in common speech. And the bones are in order of proximal to distal. It's your femur, well, no, I guess they're not in order, mostly in order. So femur is first, that's in your thigh. Then the femur makes a joint with the tibia and fibula. They're found in your shin. And the patella sits between that joint, between the femur, tibia, and fibula. The patella is your kneecap. Then as you move down distally, you have the tarsals, then the metatarsals, and then the phalanges. And you may notice that you have phalanges here, just like you had in the hand. The phalanges are your fingers or toes. They get the same name. Singular for phalanges is called a phalanx. So if you're just talking about one of the bones, it's a phalanx. You'll actually see that in some of your practice assessments. So the femur, sometimes it's called the thigh bone. It's the longest bone in your body and the strongest bone in your body. And that's because it has to support almost all of your body weight. So everything above it has to sit on the femur. It extends from your hip down to your knee, and it actually curves inwards slightly. Your femur doesn't sit straight up and down perpendicular to the ground because of how it has to support our weight. It's actually bent a little bit, the bone isn't bent, but it's slanted a little bit towards your mid-sagittal line. So the head of the femur fits into the acetabulum on the hip bone, and that is a ball and socket, and it's a common injury in elderly patients, especially women, because women are more prone to osteoporosis. So if in the process of aging, you tend to get a little more shaky, a little less coordinated. So if an elderly person falls, and especially if they have osteoporosis, they're much more at risk for breaking the head of the femur or breaking the acetabulum. And then it requires a surgery to be repaired. If this were not COVID year, we would actually be watching in class a film of a hip replacement. It's actually kind of neat, but we are not allowed to stream our video collection online, so maybe next year we'll get to it. The femur makes a joint. It articulates with the tibia at the condyles, medial and lateral. And then the femur also has some of these other features. Those you're not going to be required to know those for your exams here, but just in case you see them, they're listed out here. Now your kneecap, you can actually kind of feel this. It's called the patella. It's a sesamoid bone. It articulates with the femur at the distal anterior surface. And because it's sesamoid, it's actually kind of in the tendon that passes through the front or the anterior of your knee. And your knee joint is the most complex, complicated joint in the human body. It's a fascinating piece of evolution because our ancestors started off as quadrupeds walking on all fours and then shifted to being bipeds walking on two. So that knee joint had to be repurposed. And because of its exceeding complexity, it is very easy to injure and it causes a lot of pain. If any of you follow sports, you probably know when an athlete gets a knee injury, people kind of hold their breath waiting on the prognosis because they know it can spell the end of your career if it's that bad. But you have 4 bones involved and many ligaments, the joint capsule. So it's important to take good care of your knees for sure. Here's a picture of the femur, and I've also linked this on your class materials page. Here's the head of the femur. This is the part that articulates with the hip bone, okay, and you can see it does form basically a socket. It's really difficult to dislocate this bone. Instead, you're going to break this off. Here are the trochanters, okay, and the tuberosities here. And then on this distal end, this is where the femur will articulate with your knee bones down here. And you can see these really well. This forms a hinge joint. So you have another hinge joint here. So the tibia and fibula, be careful with how you write them and how you say them. Students sometimes mix them up. They say tibula and fibia, but that's not correct. So tibia, fibula. So if you think like the mnemonic, a fib is like a lie, so the fibula has an L in it, but the tibia doesn't. Okay. So the tibia is commonly called your shin bone. That's in the front. If you play soccer, that's where you would put a shin guard. Or if you've ever seen a horrific soccer injury and a bone coming through the shin, that's the tibia, if there's a break there. It's the larger of the 2 lower leg bones. In fact, if you were to compare tibia and fibula to your radius and ulna in your forearm, radius and ulna are much closer in size, but the tibia is substantially larger than the fibula. It articulates with the femur, and it also, on the distal end, articulates with the talus, which is one of your tarsal bones, aka your ankle bone, okay? And the talus has to be quite large to also support the weight of your body. So for the fibula, it's much more slender. It's a lateral, so the tibia is medial, and it doesn't really bear your body weight, and it's not made up of, it doesn't really function in the knee joint. How it does function is it forms a pivot joint with your tibia. It articulates with the tibia, and that allows you to basically, like if you hold your leg out in front of you and with your toes pointed upwards, you can point your toes left or right. You can kind of twist your foot around with that joint. And again, here's a picture of them, okay? If you have ever eaten a chicken drumstick or a chicken leg, you could actually see the fibula. The tibia is the part that you grab onto, that you hold when you're eating it. But you could actually pull the meat kind of aside, and the fibula is this teeny tiny little bone. Sometimes if you're eating too fast or you eat it wrong, you can actually poke yourself with the edge of it. So you have to be careful. We use a lot of food analogies in this course because that's what you're likely to be familiar with. All right, the foot bones. The foot consists of, you have an ankle, an instep, and your toes. So these are analogous to your wrist, your palm, and your fingers in the hand. So the ankle bone, you have 7 tarsal bones. They each have their own name. This is a little bit different from the carpal bones in the wrist. You have 8 of those. So 7 tarsal bones. The talus is your main ankle bone. It articulates with both the tibia and fibula, and it supports your weight. The calcaneus is your heel bone, so it's on the opposite end. This one's actually even larger, and it supports even more weight of the body. You may even find when you're standing, you might notice you put more weight on your heel than you do on your toes or the ball of your foot. Your instep is made of your metatarsals, similar to your metacarpals in your hand. So you have 5 of them, and they're numbered starting with the big toe. So that one goes 1, and they're numbered up to 5. The distal heads of these form the ball of your foot, where you might stand if you were like standing on your toes, so to speak. It forms the arch of your foot along with a few of your tarsal bones. Your toes work just like the phalanges do in your fingers. So each toe has 3 phalanges, proximal, middle, and distal, except for your big toe. It doesn't have a middle one. Okay? It just has 2, and you can kind of see that if you bend your big toe, you can only see 1 joint formed there, but if you bend your other toes, you can see 2 joints. And here's what it looks like. So here's your calcaneus. You can see this is much larger than your talus. Your talus has a very special shape here. Okay, and these 2 kind of work together to support the weight of your body. And then here are your other tarsals, your metatarsals here. They're not quite the same shape as the metacarpals in the hand, and that's because the foot has very different function than the hand. The hand is for grasping, and the foot is for walking. And then your phalanges down here. Here's what your foot looks like from the top. It looks slightly more hand-like from this view, but you can see the big toe here only has 2 phalanges. The others have 3. Even your pinky toe, it has 3 phalanges. And here are your tarsals up here. And that is the end of these notes.